Welcome everyone to another panel discussion of HMA on cybersecurity in healthcare. Just some announcements again before we start. Please feel free to ask questions at any time by raising your hand or typing in your questions in the Q&A chat bubble that you find below your screen. In the interest of time, we won't be introducing the panelists, but we do have their bios if you click the link, which is now found in the chat box. So before we get on to the panel discussion, let's start with a poll, as we normally do, to first find out how many of you are familiar with cyber risk, cybersecurity. So can we put up the poll, please? So here you go. How familiar are you with cyber risk and the impact it has in providing healthcare? One, very familiar, moderately familiar, know a little, and zero knowledge. So let me wait for the votes to come in. All right. Doesn't seem like anyone's voting, but let's show the results. So there's, okay. So we have 18% are very familiar, 35% moderately familiar, 41% of you know a little, and there are 6% who have zero knowledge. So this is a good segue to our panel discussion today on cybersecurity and cyber risk. So let me now go ahead and introduce to your panelists for this afternoon. First off, we have Fuller Yu, Chief Information Security Officer of Hong Kong Hospital Authority. Hi, Fuller, good afternoon. And next off, we have Leon Chang, Head of Cyber Defense Group, Integrated Health Information Systems in Singapore. Hi, Leon, good afternoon. And Tony Kitzelmann, Chief Information Security Officer of Australian Digital Health Agency and General Manager for the agency's Cybersecurity Center. Thanks very much, everyone, for joining us this afternoon. And of course, our moderator for this afternoon's discussion is Josh Chambers, Founder and Managing Editor of GovInsider Clarion Asia. Over to you, Josh.
Thanks very much, Pinky. It's fantastic to be here today, and I'm really excited by this incredible lineup of cybersecurity experts who we have joining me today. I'll be putting questions to this panel over the next 60 minutes, but of course, I'm also keen to hear audience questions throughout. So if at any time you have a question for our distinguished lineup, put it in the Q&A box at the bottom of the screen, and I will ask it to our panelists. Now, first, let's start by setting the scene and talking about context. You've all been in cybersecurity for many years. Leon and Fuller, you've been in finance cybersecurity, and Tony, you've been in defense. What is it that sets healthcare apart? Leon, perhaps you can start on that.
Hi, thanks, Josh. Yes, the financial sector traditionally has been more mature in cybersecurity, only because they've been heavily regulated by the regulators around the world, and they've invested in cybersecurity over the years. So it's not surprising that they are more advanced. And you know, when I look across the shoulder into the healthcare sector, unfortunately, the maturity level is quite low. And that was one of the reasons why I decided to switch from the financial sector, the banking sector, and move my expertise to the healthcare sector to help the healthcare sector show up in their cybersecurity space. So that's my reason.
Fuller, how about you? What do you find that's different about healthcare?
Yeah, just to add to what Leon mentioned, I fully agree with him. In fact, you look at this, the healthcare, I think in the previous several years, the healthcare sector is really a low-hanging fruit for the cyber hackers. Reason why, I think, three. Number one is that healthcare industries previously they don't have put enough investment into the cyber security. They may not have the right resources, technology, or people to protect the information. And second thing is that if you look in the healthcare, in fact, we have a lot of very valuable information, which is the patient information. Just to compare with the finance sectors, if you lost your finance status, you know, we can change your credit card number, for example. However, we cannot change your medical history or medical record because it's permanent and it's follow you your life. So combining these two factors, I think that's why healthcare has become a low-hanging fruit. That's why I think it's particular very good industry that I think cybersecurity professionals really want to put in the resources and help the healthcare to make it better.
Two great answers already. Tony, over to you.
Well, it's hard to follow on from both Leon and Fuller. They've really summed it up for me. But look, I think this is a unique opportunity working health, coming from defence, where there's obviously a great lot of maturity around cyber resilience. I think the health sector is just a bit of a greenfield for us technologists, because there are so many things that we can do to raise the bar and help promote it. I look at health as the opportunity for all of us in cyber to actually make a difference and contribute, because our various countries are struggling to find money to survive, and the pandemic's been a great example where we're investing in health, and cyber is just something that will make a difference. Every dollar we can save for the business through having good cyber programs means more can be pushed back into the health sector to provide health services for our respective people.
And I'm going to go and follow up with another question, but actually I want to remind our audience that this is your opportunity as well to be asking these leading cybersecurity experts your questions to learn how you can make change within your own organization. But we're going to kick off and talk a little bit about cyber risk. What is cyber risk? Fuller, perhaps you could give us some idea of that.
Sure. I think if you talk about the cyber risk, I think it's very important to understand this is a risk itself, right? So cyber risk, I think first of all, to set a background, cyber risk is not IT risk, it's not IT problem. Cyber risk really in healthcare context, in my mind, I think cyber risk is directly correlated to your patient safety risk. And then it's also should be part of your organizational level risk as well. Why? Because today, even in any healthcare providers, you rely a lot on the IT to run your business. You use the IT system to help to treat your patient and to have your clinical users to really make use of the information to provide the service to the patient. So the cyber risk itself is really a risk around, what's the risk associated with the information that you're relying on. It's also a risk around how you make sure your operational, organization or operation is not being infected because of the cyber attack. So in a nutshell, I think the cyber risk really part of the business risk and has to be taken care as a part of the organization risk. And I think how it affected healthcare, I think I mentioned already, is about you have to make sure your information, your critical information systems has to be available all the time to serve your patient 24/7. Has to be reliable in terms of the accuracy. So it's talking about the data integrity. And finally, the information has to be secure. So only the authorized person can access that. So this is about the data confidentiality. This is very fundamental concept, but I think when you combine it together, you can really have a good picture to paint and you try to articulate this as cyber risk for your healthcare organization.
We've had a question in from the crowd already. This is from Edwin. How important is cyber insurance as a tool, as a risk management strategy? Fuller, you've just been talking about risk. So cyber insurance, how does that play into your risk strategy?
Yeah, I think the cyber insurance is a hot topic in the previous year. It's quite mature in the US or in the European. There's a lot of a commercial company they buy the insurance to hedge the cyber risk. However, I think in Asia, regardless of the industries, the cyber insurance is still a new concept because I think it has its value, of course. Because when you deal with your cyber incidents, there's a lot of additional costs that through the cyber insurance you can hedge the risk. However, I think there's its own limitation. So I think to use as a tool, I think the best way is really to leverage the exercise when you are engaging the insurance risk. I think there's one important exercise to help you to assess your current status. And then through the assessment, you can really find out what's your key risk, where's your key weakest link, and then pick up those areas. And then you can invest the right amount of resources to adjust that. And after that, through the process, you can better understand where's your crown jewels, where's the critical information, and where's your critical system you have to rely on to support your fundamental services. So this, I think, is a good way to really leverage the cyber insurance with cyber insurance tools, and then how to make sure it can be part of your risk program as well.
Great question, Edwin. Thank you very much. And we've heard that it's still relatively nascent in Asia, mature in the United States. Tony, cyber insurance in Australia, how developed is it there? How much do you guys use it?
I've got to say, it actually, at this stage, it hasn't matured to actually have a place in the sector. I agree with what Fuller was saying. It's a great way to actually get the business to think through the risks that they're managing and understand and bring context around their own maturity. But I always look at this, and I think it has more relevance to some of the other sectors like finance and that, where you need to mitigate against risk of liability. But I don't know how you insure against losing people's trust. And that's something that cybersecurity in the health sector is very focused on in regards to, well, we need to be here to keep confidence and the trust of our citizens who've given us their records to look after, and so that we can provide that. So I'm still not believing that cyber insurance is here. I think the time's out to see if it's actually going to become something significant for our sector.
Great answer. Thanks, Tony. Right, let's turn to the threats now. What are the threats that we're facing? Leon, perhaps you can talk a little bit about how COVID-19 has seen the cybersecurity landscape change and some of the active threats that we should be anticipating at the moment.
Okay, no, thanks, Josh. First of all, there's a saying that says, in crisis, there are always opportunities. I think many of us are familiar with that saying, right? Opportunities are bought during crisis situation. And that saying actually applies to criminals and attackers as well, right? They will capitalize on opportunities during a COVID situation as well, where there is a lot of fear out there. So we have seen a spike in attackers during the COVID period. For example, during the early months of the COVID-19 situation, we've seen a spike in attackers trying to penetrate through our perimeter defense, and that is evident during the start of the COVID season. But the most pronounced attack form is still through phishing. Phishing is still by far the cheapest and the most easily exploited attack mode by perpetrators. And there are even services out there where you could pay them a fixed price and they'll go and phish the target audience that you want in the hope of stealing credentials. Because the idea of phishing is to steal credentials of people in the organization, because it is through those credentials, credential theft, that perpetrators can then find a foothold to gain entry into the system. Yeah. So, and in the early days of COVID-19, we saw a huge spike in phishing campaign, perpetrators posing themselves as hospitals trying to get private information. And also many organizations are putting in place contact tracing to help trace infected individuals. And there's a lot of fear out there. As a result of that, attackers are using those fear and leaning on that to try and capture credentials from the public. Yeah. So yes, they have exploited in many ways. So we see both internally and externally. And sad to say, the phishing attack will continue post COVID-19.
And just to ask, for the 20-something% of participants who expressed very, very little knowledge of cybersecurity before they joined this session, what exactly do we mean by phishing? How would that manifest itself?
Okay, so phishing campaign are individuals sending emails, for example, emails to your private emails or to your corporate emails. And these are not legitimate emails. They go in, they may be embedded with malware, or they may be directing you to a website in the hope of you revealing your password, revealing your identity, revealing personal information, revealing your bank accounts, revealing your passwords, and all that. So, and that is really about phishing, in the hope of stealing your personal information, and then we will use those information for other purposes. So that in a nutshell is phishing.
Nice answer, thank you. Tony, what are you seeing out there? What are the things that we should be worried about at the moment? What have you seen this year?
It's been a big year. COVID-19 rolled down. Our workforce went mobile and all went home. We had to extend the fabric of our networks out to support all of our folk no longer coming to the office. And it's been an interesting year for us. From a cyber perspective, it's been important to bring our staff on the journey that whilst they're working remotely and sitting out in these home environments, that they're actually still connected into the network and they're still part of the office environment. So having that education program out there about keeping them informed, and I think also about keeping them socially connected to what's going on. We've seen thousands of phishing campaigns, some really very sophisticated actors with targeted payloads specifically focused in on key executives within our organisation, and just taking those real world examples and sharing them with different people from the sector and saying, this is going on, guys, you need to be aware of this. This is what it looks like. This is not an easy thing to pick up on, and raising the awareness that while you're working at home, you really need to be on the ball and be conscious of the risks associated with it. We're also seeing some wonderful things coming out of it. The blossoming of telehealth in Australia. Traditionally, we were seeing really small numbers of telehealth being adopted across the health sector, but as the technology was available and the demand increased because people couldn't get to see their doctors, we're seeing the benefits, I suppose you would call, of this last 6 months is an uptake of telehealth services and technology actually being embraced as an opportunity to provide better health services to the country. So it's been ups and downs, but it's definitely been an interesting year. Lots of cyber, and the cyber criminals, like Leon was saying, they're always waiting for that next opportunity. Whilst we're always sitting here to protect our systems, they're always looking for that next little thing that they can leverage to gain an advantage over our employees or us as an organisation.
Fulu, do you want to jump in quickly on that? What are you seeing out there?
Sure, I think as what the panelists discussed already, in fact, the cyber attacker, they exploit the COVID-19 pandemic. Because just as what Leon mentioned, they use a lot of phishing email, and the phishing email is really targeting the human emotion. And during the social distancing, I think people is quite panicked. And I think this is a lot of opportunity for the attacker. Just look in the figures in the previous several months. Those fake domains, they increased more than 2 times. You're talking about the number of the phishing email campaign is up to 4 times, globally. So I think it's a lot of this challenge to the health organization and also other sectors. And put the health organization in particular, we are offers are fighting, we're combating the COVID-19. So the healthcare, our frontline people, they are more relying on our system. So the systems are really become a key issue. And you see a lot, that's why lots of ransomware. I hope you understand what's a ransomware. Basically, this is some of the malware. They infect your machine and try to encrypt all your file, your documentation, and you cannot open the file, and your system just shut down unless you pay the ransom to unload that. And we do see some of the organization, healthcare organization, pharmacy, laboratory, they're being impacted by the ransomware, and they have to, we have some reports say they have to pay for that. And you can see this is exactly how the hackers, monetize the opportunities. And secondly, if you look at, because of social distancing, as what Tony mentioned, it's a lot of opportunity to have the opportunity to make use of the technologies because the demands are there. And you also cause the additional risk because your network become more externalized. You have a lot of device. In the previously, you have only your own device. Right now, you also need to connect, the company network with the device that's out of your control. So there's a lot of new risks associated with that as well. So this is what we see. And I think from the cybersecurity professional, I think we are even in a more challenging period to, number one, make sure the system is up and running to support the frontline. Secondly, to deal with this increased risk because of the social distancing and the increased demands, on the IT side.
Fantastic. And I see that some of our audience are taking advantage of the ability to ask questions of our resident cyber geniuses, maybe genii, I'm not sure of the plural myself, but we've got a question coming, keep them coming. And this question is, what is the process to evaluate the current cybersecurity level in a hospital, and then the steps you can take to address that. Leon, perhaps you could start on that. How would you go about evaluating your current cybersecurity status?
I think it's a big question, because I would start by beginning to ask ourselves, what is the crown jewel? What is the critical assets that the hospital wants to protect? We must start with an end in mind. And once we have the end in mind, then we can build in the cyber defense and the cyber security around protecting those assets. So I would say, first thing, know what you want to protect in the hospitals. Is it the medical records, or is it something else? Know the assets that goes around it to support it, to keep it up. And then what controls that you have, what defense lines do you have, from your perimeter defense all the way to data security? What are the different lines of defense you have to protect that asset? Yeah, and once you put that into a frame, then you need to ask yourself, what is the underlying people process? What is the underlying operational process that needs to be in place to ensure that security, those controls are adequately effective when protecting those assets? So once you map those out, then you can draw a maturity journey where you are now and where you want to end up with, and plot that into a roadmap, and then you then start the journey.
Fuller, do you quickly want to jump in on that?
Yeah, I fully agree with what Leon mentioned. I just want to maybe just add a few things on that. So there's a lot of way to do the process, and I think you can really articulate the maturity level. For example, you can say level 1 to 5. I think not necessarily every hospital need to go for level 5, because this is the highest level, maybe more on the defense on other industries. It's really to try to understand where is your risk and what is the threat actors. Threat means who is the bad guy trying to try to hack you or try to steal your information. Who are them? And then you start to just think about from their side, and think about, if this is the hacker, this is the kind of actor that's going to impact me, how we should prepare ourselves from 3 areas. First of all is the process. I think we have a good process from, for example, onboarding your people as assets, or what's the process to acquire the system, what's the process when you deal with your third party to establish the third party supply chains process. And second area is on the technologies. So what's the technology you have? How your VPN systems secure? Do you use any public cloud? What's your how you deal with those technology, and what kind of information they are being processed with this technology? Final one aspect is the people. So it's really about how mature your people in terms of their cybersecurity awareness. Do they know how to identify phishing email? They do know if the phishing email come in their email box. Do they know there's a way to report the phishing email? Do you exercise the mock phishing exercise on the regular basis? How frequent your people understand those information, and do you provide any situational awareness? Just for example, in the COVID-19, how do you make sure you address the people emotion? So from the process, technology, and people, this is the area you can evaluate your mature model, and then always start with the critical thing first. So spot out your weakest people, spot out your most important information, and spot out your critical process and business process, and also your critical supply vendor, and try to protect from them as a top priority.
Great advice, thank you. Tony, hospitals, healthcare organizations, they've spent years, perhaps even over a decade, trying to ensure the security of their systems within their buildings. But now this year, we're seeing people working remotely. How has that changed the game, and what can we do to quickly make sure that all of these new systems that people are using, all of these personal devices that they're connecting with, are secure as well?
Look, Josh, it's a great question, and it's really hard because there's lots of people, as Fuller and Leon explained, are on the different maturity journey, and they're going to be at different stages. So there's not a one fix to all. But the thing I think I'd say, if you're out there and your workforce is mobile, understand and get telemetry on where they are and how they're connecting. If you have the ability with your technology to make them come home to you before they go out to the internet. So by that I mean have constantly on VPN services, so that the second they switch their computer on, they establish an internet connection via their home modem, and then it brings them straight back to the office and brings them on-prem so that they get the wrap of the mothership and the security around. That's a really good, simple thing that you can do, because what you're doing there is you're actually allowing that workforce, whilst out there remotely, they still get the advantages of all the security and monitoring that you've got in your system. It's important to also remember, though, that the folks will be out there, and there's always the risk that those machines will be compromised. And it's, I think it's really important for cyber professionals out there to be looking at how the workforce is actually operating. So when are people logging on? What sort of trends are we seeing for throughputs of data? And starting to look for the ripple in the wave when something goes wrong. All too often we see people come afterwards and look back and go, well, we should have seen that. We've seen that there was an increase in activity from that person that we've never seen before. Why hadn't we built a profile around understanding what was going on with them? Also, don't let basic hygiene, before I love some of the analogies about security maturity, this is just about business resilience. If your workforce are going to be out there and remote, make sure you're still patching and looking after them. Make sure that their machines are up to date. They've got the latest antivirus definitions on board, that they've got the latest policies that you deploy from your internal IT systems, because that's what makes people stay safe. Just because you can't see them and you can walk around and have a cup of tea or a cup of coffee with them, doesn't mean that they're still not part of the workforce, and you need to make sure that the protection you were giving them before is being pushed out consistently so that they have that support they need to do business.
Okay, and we've got some more questions that have come in from the audience. I'm going to combine two and put them to you first, Leon. Essentially, somebody's saying, look, I'm going to read between the lines here. Look, I'm quite worried. We want to invest in healthcare tech. We want to invest in medical devices and IoT, but is this just going to massively increase my cyber risk? And how can I balance that risk with things like two-factor authentication logins without actually making it impossible to use these devices to save people's lives? Leon, what would you take on buying new tech and how you can manage that risk with actually the importance of using it?
Yeah. I think first it's important to recognize that all this is about risk management. Cyber security, cyber concern it's not an IT issue, it's actually a risk management issue. If organizations start from that point, that is all about managing risk, then you look at each of your items and deal with it from a risk management perspective. So you're right, medical device is now the emerging risk area. Many organizations have invested in the IT environment, and that is pretty well protected. But hospitals are very porous environment. All right, hospitals are typically built to provide public access. Hospitals are typically a high user of technology. And hospitals are typically built to care for patients. When you combine these, and plus the fact that medical device is now getting more consumable and getting smaller and connected to the network, you have a very porous hospital environment where the entry point for cybersecurity is there. So do we need to invest in protecting? Yes, we do. But where do we invest it? We need to know where are the entry points. So for example, you talk about medical device. Where do we invest? Perhaps where medical devices are connected to your internal IT networks. That could be entry point where you may want to protect well. Medical device that is being standalone, in use standalone, perhaps the risk is less, right? I think someone earlier asked the question, how does cybersecurity in the hospital, in the healthcare sector compare to other sector? You know, coming from a banking sector, I could say, you know, in the worst case situation in the bank, if there's a cyber attack, we'll lose the reputation, we'll lose some money, that's not it. But in a healthcare setting, if there's a cyber attack, yes, you lose reputation, yes, you lose some money, but potentially you lose a patient's life. So there's a huge patient safety angle to it, which adds the complexity that the banking sector, for example, do not have to be concerned with. So once hospitals and organizations are clear, what are they trying to protect? Then you build your cyber defense, your cyber risk management all around it. Yeah, and And again, there's no one size fit all to this problem. So we just have to take it one step at a time from a risk-based perspective. Back to you, Josh.
We've got some great questions still coming in. So we've got another one here. And let me set the scene on this first. So some of the most serious threats in cybersecurity are called advanced persistent threats. And that's where quite advanced hackers can get into your system and they can be lurking there for quite a long time before anyone notices they're there. So we've got a question here from Ganesh that says, what steps can you take to detect if your security has been compromised in any way? Is this automated, Fuller? Over to you. How can you even know if you've been compromised?
I think it's a good question. I hope it can be automated so that we don't need to work on cybersecurity and we can retire. Just kidding. I think it's a great question. First of all, I think even you think about the compromise, you can think before that. Is that before compromise, can you do something to prevent first and to prepare yourself? So in the cybersecurity, we always talk about the preparation. Because if you look at cybersecurity if you're talking about as a cyber risk, it's always something impact your operation, right? So you should have some kind of a business contingency plan. And cybersecurity should be one of the scenario that if something happens, it can be ransomware, it can be someone hack your system, it can be the DDoS, distribute DDoS service to your system, blah, blah, blah. They are all the scenario. But can you prepare for that? So this is all about to make sure you have a good contingency plan. We call it as a cybersecurity resilience plan. So make sure if something happens, do you have a good communication system? That is maybe a out-of-band communication channel. So you work with your people to restore your system. And also, as I mentioned, this is really a business risk. So that you have to make sure your clinical staff, they will know that if something doesn't work because of cyber attacks, do they have an alternate way to continue the critical process to treat the patient and to continue to provide the services. And if something identifies, hopefully you can detect the attacks from the early stage. Because if you look at the cyber attacks, it's really not single one come in and then you are done. It's really, they take some time. So if you, as we have some good terminology called the cyber kill chain. So basically the attacker will come into your environment to do a lot of recon and try to identify where your critical information. That will take some time, maybe 1 day, 2 days, few weeks. And then I think during this period, if you can identify some of the anomalous activities, you can at the early stage you can block the bad guy from your environment and you can kick them out. So this is what we try to do. So in a nutshell, we cannot have a fully automated mechanism, but we can prepare ourselves to respond if something happens. How can we contain the bad guys at the early stage? If they really create some damage, can you execute your contingency plan to make sure you can minimize the impact and make sure your business is being impacted at a minimal level, and then you can just contain yourself and restore the systems from the kimberley. So this is what we try to do right now.
Tony, talk us through it from a hospital leader's perspective. You're wondering how you can build a system that will detect whether you've been hacked and how you can ensure you respond quickly. What are some of the steps that you would take as a leader to ensure that you are ready and you can detect these threats?
Look, it is it's a challenge for a lot of people to sit down, but I think you need to start at the foundation block, and it's like building a house by getting those foundation right. So when you build your networks in the hospital environments, you want to make sure that you actually take that risk-based approach to understanding that not all data and not all of those assets are equal. So design your solution in a way that those close hold things that are dear to you, for example, your patient data records, are in a segregated zone of a network, because there are certain things that the adversary will go after because they have monetary value. We all know the value of health records on the dark web and the fact that they are the crown jewels for an adversary to come into. So make sure that you wrap and protect those and layer your system in a way that actually allows those administrative functions that you provide and support to your hospital to be separated from those core medical records. I was looking at an earlier question that was moving on and was talking about, well, how do we deal with the fabric of IoT? And the Leon was talking about the hospital environments are porous. They've been designed to be able to be easy accessed, and that's equally so with the technology that goes into supporting hospital. So for me, it's about build those layers in, protect and know your assets, and work out how you can protect them and set them up differently. I would also suggest that one of the keys to understanding what's going on in your environment and detecting when a cyber attack, the cyber kill chain, and I must admit, I know the team from Lockheed Martin in my previous life that actually developed the cyber kill chain, and it's a really great example of how technology can be used to define the steps necessary for a bad guy to get into your system. Everybody says, oh, it's so hard for me as a technologist to defend the system because I've only got to find one way in. Well, the simple reality is it's not about one way, it's about finding multiple steps through your system to get access to those crown jewels. So set up monitoring and surveillance technologies inside your system so that when the adversary does the reconnaissance, like Fuller said, you'll be able to see them sniffing around the boundary of your device. Monitor the dark web for people talking about you. Bad guys love to talk, and they're going to be jumping out there asking each other, hey, have you been over to see the Australian Digital Health Agency? What sort of security they've got? Will we trigger any of their systems when we go past their front door and have a look at their gateway environments? If you start understanding the conversation that's been occurring in the dark web and building your system so that the threat intelligence can come in, and with all that telemetry that you build into your system and it starts to bring together, you'll actually be able to see the footprints in the snow as they start to move around your network and set off your early detection systems. So it's not all doom and gloom, but it does require a level of maturity in technology. And you also have to understand it is truly, cybersecurity maturity is not a destination, it's a journey. And we've all got to understand that it's about moving up one step at a time and improving ever so slightly so that you can actually become more and more resilient. Just like in a hospital, we have dual power supplies and backup generators. In cybersecurity maturity, it's about having backup of your data sets. It's about having multiple defensive systems so that if your system does get attacked, you've got a second network to connect onto. All of those sorts of things just need to be applied in the technology realm of hospitals.
Got some fantastic questions in from the audience. Please keep them coming in the chat box below. First, I'm going to read one out that's a little more of a comment than a direct question, but it's Tarek has noted that actually cyber attacks can even be the cause of death of a patient, as we tragically saw, in fact, in Germany this week, where ransomware did indeed cause that tragedy. It's a very important point and underpins the seriousness of this subject today. We have a question about medical devices, I think following on from what Leon was saying earlier, noting that the problem with medical devices, they can be running on outdated operating systems. Very briefly, Leon, perhaps 30 seconds or a minute, what would you recommend you could do for medical devices running on old operating systems?
One, you have to find some investments to get rid of it, change it. And I know it's a tall order, but you just have to replace the operating system. Secondly is do what you can. Some of these medical devices uses a USB port, and those are entry point for malwares. If you can lock them down, right? If the device can be disconnected from the network to prevent the transmission to the rest of the network, to decouple it. So these are small things that can be done to isolate the risk if you can't change the operating system.
Thank you. We've got a broader question here from Ong, and he's asking about the possible vulnerable areas for cybersecurity in the hospital setting. It's quite a broad one, that, but Fuller, if you were to identify 2 or 3 key vulnerabilities that people watching should be addressing, what would they be? Okay, I think in the industry, we always say people is the weakest link. So hopefully this is, do not disappoint, the person who asked the question. In fact, cybersecurity is not about the technologies. We do have a lot of good technologies, firewall, detections, even we have a lot of AI to improve the cybersecurity. However, I think in many years, we all believe that the people is still the weakest link. So I think one of the vulnerable, I have to say this is always the people. So do your people really, number one, they understand they are accountable for the cybersecurity? Because every user, they are using the information, right? So do they know that they are accountable to protect the information? Very simple, by when they left the desktop, they will just lock the screen. Or when they handle the information, do they know they cannot share the password,
they have to create strong password. They have to really make sure they're accountable for the access. And I think it's a very basic thing, but I think this is one of the area, I think if you have the chance, you have to look at that from the people side. And second is a look into the detection, because wherever you do a lot of prevention is good. However, there's no silver bullet on the prevention system for the protection. So you have to really focusing on the detection. As I mentioned, the hacker coming is not a question of if, it's a question of when. So you expect someone already in your network, and how to win is that to how quickly you can identify those bad guys in your network. And hopefully before they create the damage, you can identify them and kick them out. So this is a really can invest on your detection mechanism. Is your detection strong enough? Do you have a good team to look into the your environment 24/7? So if something happens, they can respond in a quick manner. I think this is two areas you can start to look at that.
Fantastic, thank you. If you were to add to those two areas, Tony, anything else that you'd jump in with?
Look, the one thing it is a complex environment in a health environment. And look, we always see things like the old post-it notes floating around with passwords written on the back of them. Look for ways to actually bring technology in that will actually make it easy for the staff. I'm a firm believer that we should all have the Google experience when we go to work, where we walk into the office, our smart device syncs onto our work network, and I just get to hit an authorized button on my smart device and put my username in, and off I go and connect in. All too often we're making it hard for folks so that they are forced to use technologies in ways that aren't, and whether it's writing passwords down because they're too complicated, or doing silly things like allowing staff to use their administrator accounts looking after the network to browse the internet and do their eBay shopping during their lunch break. They're the sorts of things that can really let you down. So a little bit of good solid hygiene will go a long way. And I think we have an onus on us as technology experts to find ways to actually bring the tech that's out there to bear in a good way to help our staff be more productive and actually adopt systems in an easier way. I'm a firm believer that if we can make something simple like a password and find ways to mechanism, or if we can find ways to allow networks to mesh together better so that you don't have to enter a million different username and passwords to move through it, they're things that we should be doing.
Nice. And Leon, let's follow up on that last point by Tony there, because let's call it, people are tired at the moment. They've got a huge challenge that they're battling. They're, really stressed and struggling with the anxiety of a pandemic and the vital medical work that is being conducted in these organizations as well. How do we communicate with staff about the importance of cybersecurity, and how do we make sure that this isn't just another stress on them with all of the other things as well? What advice do you have for the leaders who are watching on how to communicate with staff, Leon?
Okay, the tagline I use is this: doctors and nurses and healthcare workers are great when it comes to caring. That's why they're in the industry. It's a caring industry, about caring for patients. All right, and doing what's right medically for the patients, and that is foremost in the healthcare industry. If we are able to transfer that care mindset to cybersecurity, cybersecurity is also about caring for the patient, because if they care by taking security in mind when they log in their systems and not leave their password around, and not allowing perpetrators get hold of their patients' medical records, that's also another form of caring for their patients, not compromising their patients' medical records, because once it's compromised, who knows what that might lead to for their patients. So I think it's a mindset shift, if you want to ask me, that doctors who are great at managing the risks, the health risks of the patients in a medical sense, can easily transfer that mindset to caring for the patient from a cybersecurity. And I think that is the paradigm shift I want to encourage everyone. And at the end of the day, cybersecurity is everyone's responsibility. It's not Tony or Fuller or my responsibility. It's everyone in the healthcare. If we are serious about looking after our patients medically, then we should also be concerned about them from a cybersecurity point of view.
And Fuller, we've had a fantastic question here in from the audience, and please, to the audience, keep those questions coming in the box below. But we've got a great one here which reminds us that we have vendors, we have suppliers as well, who represent something of a cybersecurity risk. They need to be accessing our systems for various reasons, but who knows what cybersecurity measures they have. So Fuller, what would you recommend to people to ensure that their vendors, their suppliers are also secure and that they're not the weak links?
Yeah, this is a really good question because, as I think I mentioned a little bit earlier, is that the supply chain risk is one of the key risks that I think the company need to look into. Because right now we rely on lots of vendor. For example, you have a lot of vendor system that they are really the IoT or those OT system, and you cannot have the full understanding. So rely on the vendor to do that. So I think right now one of the technologies that to start with, first one is to understand how many vendors you have they can access to your system. Because you look into the previous big incident, I think quite a lot of incidents really because of the vendor, their systems is weak, and someone, they are just hacking the vendor system, and then they hack your full the connection you have. And even though it's simple cases, your vendor do a maintenance job, they come into your hospital and just plug a thumb drive. If the thumb drive has a malware, then the system will be compromised. So I think when you deal with this vendor access or the vendor support, you have really, hopefully, first of all, you have to make sure those vendors, they follow your minimal security requirement. For example, they have to follow some of the control that you practice in your own environment, so that you can hopefully extend your control to cover the vendor. This is one of the area you can think about. Secondly, to identify who's your critical vendors, so that make sure when you have any cybersecurity response plan, those vendors has to be your partners. And if something happens, they can communicate with you and you can work them as a team. So this is the second area you need to think about that. Finally, you may do some technologies level control. For example, do a good proper network separation, and make sure only those systems should not connect to your whole environment, only connect to your designated system, that you can minimize the exposures to those vendor systems. So that this is some of the area you can look into. But I think the last point is that the whole supply chain is always a key important you to think about that, and make sure the supply chain is a part of your cyber risk during your consideration.
Nice answer. Thank you very much. And Tony, I reckon your defense experience means that you've probably got a bit to say about making sure your vendors and suppliers are secure. Perhaps you could just jump in and give your view on it as well.
Absolutely. And look, I love Fuller's response. I'm just shaking my head and nodding in agreement with him. Look, understanding and having your supply chain, you make them partners in your business, make them equally invested. We've all heard that saying, if I fail, we fail. So we need to actually have that whole method rolling through our supply chain organizations. So I think it's ultra important. Promote the standards that you need them to meet to connect to your systems. Make them demonstrate transparency and accountability for looking after the data that you've entrusted them to do when they come on board. Protect your networks and segregate them so that, like Fuller said, if they're coming in to look after your CT machines on your network, put them in a subnet so that they're protected and isolated, and monitor how their connections are. And don't just let them connect freely into your systems. Make them authenticate on your system so that you can actually validate those proper connections into your environment. And I always believe that it's important to follow up with good administrative practices. If somebody is coming in and checking on your systems and doing work for you, actually check the invoicing and the logs inside your system to make sure that they actually were in there when they say they were in there doing work, so that you can actually see the correlation. Because you'll see the correlation of when the good guys have been helping you, but you may also see the indication that somebody bad might have got into the system. So always look and understand that. But it's hard to follow Fuller with his response. He really got everything nailed up really well.
If we were at HMA Physical right now, I'd be scanning the audience looking for hands up, and I do see a question that we've got in our chat box instead that says, how do you see AI improving cybersecurity in the future of the health industry? Leon, AI in cybersecurity, how do you see it playing out?
Yes, I think it has a future. I think it has a future in the detection space of cybersecurity. Detection space of cybersecurity is where, as Tony and Fuller mentioned, where indicators and taps are in the system detecting for malicious movement, malicious activity. But typically in the security operation and detection space, it generates a lot of data, a lot of information, and the ability to sieve through that quickly in an artificial intelligence way. I think that will be would give the monitor, the operators a huge advantage in seeing malicious activity within the network. So I see, yes, in some ways AI is already here in the cybersecurity space, but I think it can do more in the future.
Let's go straight on to our next question. So we've got a lot of hospitals and healthcare providers specifically in the audience joining us today. We want some advice on how, if you're running or you're part of a hospital in particular, you would start on your journey from today of making your organization more secure. Leon, back to you on that. How, if you're in a hospital, would you start on your journey today? After listening to you right now, what would you go away and immediately do?
I think it starts from the tone from the top. It starts from the board. It starts from management. Yeah. While there are many good ideas from this talk, but if the top of the house, if the board, if the management don't buy into it, then it's going to be a real challenge for your cybersecurity program. So it starts with the tone from the top. The leaders of the organization must walk the talk. I would also add that cybersecurity is the cost of doing business. It's not an add-on. It's part of doing business, part of providing healthcare business. So I think if we can achieve that mindset from the leaders that this is part of doing healthcare business to provide cybersecurity, then you have half the battle won. Yeah, and the other half of the battle is balance. Generally, the hospitals are good at cost-return trade-off. You know, would they spend that kind of money for this medical device or this medical system? But I think we need to bring risk to the table. So it's a tripartite discussion of costs, the return, and the risk to the organization. If they balance the discussion between risk, cost, and return, and then based on that, overlay that with their risk appetite against patient safety, against loss of reputation, then I think you'll get a logical outcome from that.
I like that phrase. Cybersecurity is the cost of doing business. That's a great line, actually. I'm sure I'm going to end up using that again sometime. Fuller, what advice would you have to the healthcare practitioners, to the hospitals who are watching today?
Yeah, this is a question around how do you get the money from the board? So I think to start with, I think you can look into two aspects. The first aspect is that hopefully your cybersecurity program should be tied to your digital transformation journey, because I know a lot of healthcare provider, if you are really on the digital transformation journey, it can be offer a better touch with the patient through the technology. You make use of the technology to figure out a better service using the AI, for example. So it's a lot of a digital transformation program in the healthcare. And I think one winning point is that how you articulate those programs and tie in your cybersecurity as a part of the requirement. And hopefully the cybersecurity become an enabler to help those transformations. So this is how to sell your program. This is number one. On the second, as what Leo mentioned, cybersecurity has to be a part of cost to run your business. So it's not a necessary evil. It's really an important cost that you have to pay to make sure you can protect your brand, protect your reputation, and preserve the trust with you and your patient. So that is also important to start with that. And I think one important thing is to really, a few of us mentioned, is to start with an end. So you will make sure this is your end goal, this is your end pictures, this is your the future, the end state in terms of maturity, and where we are, and hopefully this is the gap that we can really to fill. And this is the way to show how your program can fill in the gap and help the business to run their digital transformation in a secure way and in a reliable way. Because at the end of the day, it's really to improve the healthcare service to your customer or to your patient.
Another fantastic answer. Thank you very much, Tony. What advice do you have?
Look, I think it's important to understand that we need to make sure that our strategy is aligned and it provides focus to the business on why we're actually doing this. All too often as technologists and cybersecurity folk, we forget that it's not this mythical thing, and it's just part of delivering good IT services for your business. So make sure that your strategy talks about building resilience, making the business secure and stable, and to be able to provide healthcare. I loved Leon's analogy earlier on before when we were talking about the components of using the right language. For me, when I talk to healthcare professionals about cyber, I talk about it as a safety mechanism that you can put into your system to enable your workforce to deliver safe services to your healthcare recipients. Look at informing and always understand the risk of doing business, and make sure that your sector doesn't become an industry, an ambulance chaser looking for those opportunities to run in and cry wolf and say, well, we should have done something about this. Be that considered advisor that can come along and say, well, this is what we need to do. We are going to be subjected to a cyber attack in the future. It's not about if it's going to happen, it's going to be about when it's going to happen, and give them the necessary knowledge up front so that they're able to make informed decisions that will help them be resilient and provide that meaningful leadership that you'll need in the time of a cyber crisis. One thing I always would encourage you to do when you're talking in the health sector is, in the forefront of your mind, is promote innovation. Look for ways that you, as a cyber practitioner and a cyber specialist or a technologist, can actually work with the business to understand what innovative ways are coming, and look for ways to make it work, as opposed to looking for ways to block it and make it over secure. Sometimes, without a little bit of risk, you'll lose the appetite of your organisation because you won't allow them to evolve and meet to take advantage of the emerging technologies that are out there right now. And there are some wonderful things. My daughter always says to me, Dad, why can't my smartwatch connect to my health record so that I can upload my health data that I want to on it? And she's 100% correct. We should be looking to ways to bring technology into the health system and make it all-encompassing and supported in a way that actually drives innovation.
Fantastic answer. Thank you very much. I'm going to ask one more very quick question. Please answer in 1 minute or less. We've heard at the beginning some of the threats and reasons to be fearful, but I'd like to finish off with reasons to be cheerful. What is exciting you at the moment? What's a reason to be optimistic, Leon? What makes you excited?
In the cybersecurity space?
Sure.
Yeah, it's the very fact that there are a lot more discussion about this topic is exciting for me. It is a topic that has been around for a long time, but unfortunately it didn't really get enough attention in past years. So for me, it's exciting that there are a lot more non-cyber, non-techie guys talking about this topic and wanting to do something about it. To me, that is a shift that I'm happily and pleasant to see in the industry.
Fantastic. Thank you. Fuller, what's exciting you?
It's very exciting because when I discuss with my clinical users on a daily basis, they can see the value of how cybersecurity helped the digital transformation. At the end of the day, how we can have a better service to our patient, how to reach out to the patient more closely, and how to check their status using the lots of good technologies. And I think this is very exciting in the healthcare industry. So I will really encourage everyone to try to think about this one. This is very good. In fact, I see another question. Hopefully you can give me maybe 30 seconds to cover that. Is someone asked, is there any using any standard or framework that adapts in the European side or to assess our cybersecurity assessment? I think it's a good question. There's a lot of standard and framework. Some is healthcare specific, some is more general. For example, ISO 27000, NIST framework. I think there's quite a lot of framework you can really leverage. However, don't overkill. And always make sure those framework is applicable to you, because it depends on your size of your organization, and try to make use of the best part of those framework, and try to use the framework as a vehicle to drive your program and to drive your implementation, and make use that to do assessment. So this is my quick answer to your question.
Two fantastic answers. Thanks very much. Tony, what's exciting you?
Two things. First of all, the opportunity to be on an international group talking about cyber. 5 years ago in health, we wouldn't have had this conversation. And I think the biggest thing that excites me is that there is a true opportunity here for us. By bringing cyber and technology to bear to deliver health services, we have an opportunity to make it better for our children, awesome for our children's children, and just fantastic for the future generations by enabling those digital health services to come to bear so that they can actually focus on delivering health services in a meaningful way. It's just a great place to be at the moment.
Fantastic. Thank you very much. I don't know about you, but I'm excited for HMA Virtual, which is in the second week of December. And my friend Pinky is going to come back and tell us a little bit more about it. Pinky?
Thanks very much, Josh. Thanks very much. That was a very interesting discussion indeed. And thanks very much, Fuller again, Leon and Tony, for spending your afternoon, like your 1 hour with us. Quite generous. Thank you so much. And obviously to our guests, our attendees, thank you again for joining us. But before you go, just one last poll. Can we show that just before you go, guys? So yeah, just wanted to know if you're looking to set up your cybersecurity solutions, or for those of you who have, if you're looking to upgrade it within the next year. Simple yes or no. All right, we will be sharing that results for now, but we will share it in an email. We will send to everyone. But thanks again, and just as Josh mentioned, we will have HMA Virtual December 8th and 9th. So make sure to join us there. It's going to be the usual HMA with our usual tracks on patient experience, safety and quality, of course, on cybersecurity and IT, and of course on talent management. Thanks again. Thanks for joining us, and hope to see you in December. Take care.